The line of thinking initially was that everything was kind of processed in the same place.
Yeah.
And what our research is showing us now is that
Like back in the day, you're saying like back in the medieval day, everybody assumed it all came through one channel.
So
Sure.
maybe not medieval, but in the beginning of audiological research.
The 80s.
Right?
Got it.
Yeah,
Okay.
Sure.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm Kevin Ziener.
And I am Dr. Michael Squires.
Dr. Michael, it is so great to be back with you. But we also have a new member of the team. Daniel is our original OG editor, who we affectionately call Jerry. But Jerry has a new running mate, and his name is David. So if you ever have any issue or you see something that needs to be pointed out, do not come to Dr. Michael and I. Blame Daniel and blame David.
It's straight to Jerry.
Perfect. Yes, straight to Jerry. All right? Perfect. Settled. Good.
Done.
Great. Grand. Wonderful. All right. Today's episode from Dr. Deanne Rudden of Longmont Hearing in Tinnitus in Longmont, Colorado. She brings us the article simply titled, "Why Can't I Hear in Background Noise?" So, Dr. Michael, pretty simple yet convoluted question. Let's get into it. Give us one hyper-specific reason why every single person in the world can't hear with background noise.
Well, quite honestly, our brains are not really great at it.
Okay.
So there's the line of thinking initially was that everything was kind of processed in the same place. And what our research is showing us now is that
like back in the day, you're saying like back in the medieval day, everybody assumed it all came through one channel.
So maybe not medieval, but in the beginning of audiological research.
The 80s.
Right?
Got it. Okay.
Sure. Great. But anyway, everybody, in research at that time was thinking that speech and background noise and music and everything was kind of processed linearly in the same place in the brain.
Got it.
Well, now I think what we're realizing or what our research is showing is that the brain is trying to split these things up.
Okay.
And so what we have to rely on for patients with sensory neural hearing loss or a permanent hearing loss is we have to rely on the technology that's within the hearing aids.
Got it.
To artificially overcome those issues.
So let me ask my dumb guy question.
Sure.
So initially it was thought if I hear a sound of any kind, it goes to one spot in the brain and it sits there in the waiting room to be processed, no different than everybody else.
Yep.
Now, what we know now through a bunch of audiology research is depending on the sound, depending on the frequency, the decibel level, all this, it could be pinging to dozens of different spots to be translated or transmitted in dozens of different ways.
Yeah, so to really break it down.
Yeah, break it down
to the dumb guy level.
Further, to the real dumb guy level.
Breaking it down for dummies,
Yeah.
right? So the ear collects the sound, right? The cochlea, which is the organ that's responsible for hearing within the ear, is what is breaking it down to a frequency specific level and then sending it up to the brain.
Okay.
The brain is then breaking it down into its elements.
Got it.
So our brain uses timing, intensity, and frequency cues to tell us where a sound came from, whether the sound is dangerous, what that sound could mean. Is it speech? Is it just something in the background? Is it a saber-toothed tiger sneaking up on us, right? And so what we're realizing right now is background noise per se is relatively new to our brains. And so our brains have a little bit of difficulty figuring out which is which.
So
speech versus noise.
So perfect. So there's like if I'm just in a quiet room and I hear noise, I probably know where it's coming from and I can probably guess what it is.
Sure.
That gets diluted when there's more ambient / background noise happening, and that is harder to process when I have hearing loss.
Oh, absolutely. Well, the hearing loss is stealing away cognitive resources, so your brain has to work harder.
Got it.
The brain has to work even harder above that when you add complexity to the environment. So anecdotally, I can tell you that patients come back and think, I like my hearing aids, but I still can't hear in background noise.
Sure.
That's one of those things that's either very difficult or difficult to rehabilitate.
Got it.
Yeah.
So one of the things that I always think of is it's always hard to hear when it's busy anyway, right? Like we were at dinner not too long ago and it was this really happening, hopping, like Asian restaurant where the kitchen was open concept and there's plates clinking, this, that, and everything else.
Yeah.
That is probably an extreme. So most people probably struggle to hear in that just normally, even if we don't have hearing aids or hearing loss. Like, what is a good barometer of, hey, I'm in this social setting, I'm within the social gathering, and I'm struggling to hear, like, what, again, an example, because we love to give examples because then they put B-roll over our examples when they do our video clips.
Yeah, it's great.
What's a good example?
One opportunity less to see our face.
Exactly. What's a good example of, hey, if you go to like a house dinner party with 6 people and you're really struggling to hear, that might be where you want to go get it tested.
Yeah. So there's actually 2 questions in there that I hear. I hear, at what point of struggle do I go, ooh, maybe there's a problem?
Sure.
The other question I hear in there is, what can you do in that situation to make it easier, right? And maybe that wasn't your question. Maybe I'm just telling you that's what your question
I think
was.
it's first is like, hey, I think I have an issue, and I think I have an issue because I should be able to hear. And then obviously what we're going to get to is, and then how do I treat it?
Yeah, what do we do about it? Okay, so I would say that if it's a really difficult environment and you look left and you look right and your friends are going, I can't hear.
Yeah.
I can't hear what you're saying, then you're probably within the norm.
Okay.
There's a whole host of other reasons to go get your hearing tested as a baseline.
We're clearly not just saying at one dinner party, if you're struggling to hear, go immediately to an audiologist.
Right. But you could always get a baseline and then you'll know. What I would say is, if you're really struggling and you're feeling isolated and you feel like you can't participate in the conversation, maybe you and your friend should go get your hearing tested, right? So I think it's how you feel about that situation. If you feel like you can't participate, why not get it checked out, right? Get a baseline. The other thing is if there's an issue, obviously treat the hearing loss, right? And we recommend if you're going to go through this process and you're going to find out that there's a permanent hearing loss there, then follow the recommendations of the doctor that you're seeing to treat your hearing loss, whether it's a hearing aids or cochlear implant or whatever the situation is. But when you're in that environment, what you can actually do is ask for a table in a corner. So with hearing aids, let's use that as an example. With hearing aids, they're designed to kind of force some directionality, right? So it gives your ear an easier sound bite to give to the brain, so the brain doesn't have to process so much information in that environment. And so if you can keep your friends in the corner, right, put your back to the noise.
Unlike baby, we need to put our friends in the corner.
Don't keep baby in the corner. Keep your friends in the corner.
Exactly.
So there's nothing behind them to compete with.
Okay.
So now you got their voices, and then the hearing aids are designed to create a spot behind you.
Got it.
That is taking care of some of that background noise. Is it going to be perfect? Nah, probably not, right? Because that's the nature of a sensory neural hearing loss. But it's going to be a lot better.
What do you find, having been in practice for as long as you've been in practice, like, is this one of the common things people talk about when they come see you? Like, I'm fine by myself, but in a group setting.
The most common
thing.
Okay. It's the number one thing people tell me.
Got it.
Before and after treating the hearing loss.
Oh, really?
Oh, yeah. I mean, with a high frequency, with a typical presbycusic hearing loss, right, due to aging or something like that, or high frequency from noise exposure, that is going to really make background noise difficult.
Got it.
We treat the hearing loss. People can communicate much more easily, but we're relying on technology to overcome what the brain is supposed to be doing, or what we're relying on the brain to do. And what we know is the brain works pretty efficiently. And so the combination of those things takes a little bit of time and a little bit of rehabilitation. And it can work really well.
This will be the question that we end on. Typically, on average, understanding that everybody is different, when somebody comes to you and they say, I'm struggling to hear, and you diagnose and treat them with hearing aids and they go back out into the world, what is the time frame for them to start being comfortable wearing the hearing aids with the world around them?
Yeah. Well, a lot of that depends on the fitting of the hearing aids and how well they adapt initially. And so some of my patients, I'll start in a full prescription. Some patients can't handle it. And so we'll verify the prescription is correct, but we can, on a percentage basis, back it off a little bit and automatically have it work itself back up there. So 2 to 4 weeks is pretty typical, I would say. If a patient can't handle it right out of the gate, 2 to 4 weeks is where I start.
Got it.
Some patients need more time, but But I also, to put a big red bow on this thing,
Big time.
I also like to make the recommendation for some of those oral rehabilitation programs, whether you're working one-on-one with a doc or a therapist, or whether you're looking at like listening and communication enhancement. It's called LACE. That's an online program you can pay for, and it really helps in some of those situations to kind of retrain your brain on what to listen to.
Got it.
Yeah.
Love it. Whenever we wrap up an episode, I always have this thing playing in my head. It's that old PSA, the more you know.
Yeah. Da, 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 da.
And I credit that for you because you provide the information. I just ask the stupid questions.
Yeah.
But
stupid questions, stupid information.
Hey, we love it. That's what we're here for.
Stupid people.
But when it comes to hearing loss and hearing health care, the more you know is in fact better. And you can learn more about this topic and many others at askanaudiologist.com. And to you, Dr. Michael, I say marvelous job today.
Hey, thanks, Kevin. Not as good as you, though.
Thank you very much. We'll see you guys next week.
See ya.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only, and does not substitute for professional medical advice.
I guarantee you I know as little as anybody despite me hosting this podcast.
So I'll tell you this, frequency and pitch is the same thing.
Okay. And what's great is she thinks I know what pitch is.
You do.
Outside of baseball.
You do.